Hello friends, I am Dr. Sukhdev Singh. Today I am talking about chickenpox and herpes zoster. It is a disease caused by a virus herpes zoster. In children it is called chickenpox and in adult it is called herpes zoster. The sign and symptom, as you saw, there is a mixed rashes over the skin along with temperature, headache, fever, body ache, common cold, and sometimes there is involvement of the respiratory tract and brain. Due to that, there is painful rashes all over the body and difficulty in respiration also. Not only this, it can be diagnosed by the sign and symptoms plus blood test for antibody and PCR. The treatment of this disease is symptomatic along with antiviral can be given. In some cases, the patient should be isolated for 3 weeks because its incubation period is 9 to 21 days. It is a contagious disease spread by contact and droplet infection. As I have already told you, the mixed type of rashes is there with fever and along with involvement of brain and lungs. Not only this, can be diagnosis as I have told earlier and isolated for the 3 weeks. In debilitating conditions and in old ages, there is very serious effects of this virus. The vaccine is available. The 28 days apart, 2 doses of varicella zoster vaccine be given, and it start from the children at the age of 9 till the old age. In such a way, along with treatment, vaccination, isolation, we can treat this disease very effectively. There is no any problem, but sometimes it may be dangerous when it involved eyes and dorsal segment of the nerve, and there may be facial palsy also. Therefore, take treatment regularly for this disease, continuously, completely. It is all about this disease. Thank you.